Hi, Vale, good evening.
Hi, good evening. Wait, I'm just setting up here.
Okay.
Wait. Oh,
Can you turn on your camera, please?
yes. Es que I turned
Okay.
it off something and I was fixing it.
Okay, no worries.
Mhm.
Okay, Vale. Let's talk about some topics that we saw yesterday.
Okay.
Can you choose at least 3 common conditions and make like a short note of how patients would describe this pain?
How? How? I'm sorry.
Again,
Uh-huh.
you have to choose 3 conditions, okay? And explain or make a little note of how your patients would issue.
I didn't hear you. How my patient will describe what?
The conditions you chose. Imagine
Ah,
you have 3 patients that are having some trouble with their health, okay? And they will go to your consultation. And how would they explain to you what they have?
okay. So, for example, um, one my first patient is having um, dehydration. So
Oh,
he's feeling very dizzy. Um, he's feeling dizzy. He has nauseous, um, sunburn, um, I don't know what else. His mouth is dry.
mhm.
And uh-huh. That
Okay.
can be one.
Yes. Continue.
Another one can be um a
Who is helping you?
no, nobody. I'm just thinking.
Okay.
No, nobody. Maybe a person. You said can be a broken hand or broken. Can
Yes.
be
I want
yes.
to know how your patients go or to your consultation. So it can be whatever you want. It's just that you have to describe how the patient would tell you or would explain the symptoms and signs. How
Mhm.
do they go with you and tell you?
So maybe I can also say, well, we said about the one that has a broken shoulder.
Okay.
So the patient is telling me that he's having a lot of pain. He cannot move his arm back or front, and he's already taking a lot of pain relief pain
Yes.
relief uh and
Painkillers.
pain relievers, painkillers, and the pain doesn't go away. So maybe he broke his arm, but we need to take a radiography to see if it's true or it's a ligament, or I don't know. And the other one can be um the patient is telling me that when he walks, he gets tired very easily, and his heart pressure is always high, and he's having headaches a lot, headaches, and it can be a cause of hypertension or mini heart attack. I don't know, something like that.
Okay. Okay. And now, can you make a social history of a patient you know, maybe in your experience? Okay. And which questions would you obtain? Would you ask to obtain the information?
First of all, the full name, the age, where does he live, the personal details, right? Then, oh, wait, I'm sorry.
No worries.
The personal details, if the patient presents some disease or well, his medical history, right? If he takes some medicine, what kind of drugs, also the family history, and or you want like the exact questions or just as in general?
Okay, you have to ask some questions. Which kind of questions you will ask to obtain the information?
Um, like the ones that I come as like specific questions.
Yes, but the social history,
Social
social and personal history. Yeah.
social and personal history. That's the one that when we
Like the occupation, maybe personal habits, recreation, physical exercise, those kind of things. Social and personal history.
okay, like if the patients practice some sport, what kind of sport, or it can be mm, um, I
First of all, I think you need to choose or pick up um, a disease, a patient with a disease, right?
okay.
Maybe
So
then you will know. Okay.
it can be hypertension.
Okay.
If the person's if the patients go if the patient do exercise every day,
Mhm.
um what kind of work does the patient do, um marital status can be there, if he's married or not. No. That will be
It's
personal
personal
information.
details. Yeah,
Uh,
personal details. But social history, maybe if he smokes or if he drinks or go out so frequently,
uh-huh.
those kind of things. His
Uh-huh.
social
So
life.
social. Uh-huh. So what else can I ask?
If it
Mm,
helps you, it is so good. For example, do you smoke? It would be one important question if you are talking about
I
hypertension, right?
yes. Uh-huh. If the
Uh,
person smokes or drink or do any substance like
yes.
marijuana or cocaine.
Or where does he works? Maybe, I don't know.
Yes, I already. What's the occupation? What if he is working? And I don't know what else can I ask.
Okay, whatever you think it's important to know or to obtain information.
Hmm, I think just that one because I already asked if he drink or smoke or the substance where does he works, if he do exercise, maybe how often does he get out with his, I don't know, how many hours does he works can be very helpful.
Okay,
But because of stress can be one factor that can be raising up his blood pressure.
okay,
Mhm.
okay, perfect. And can you describe the examination? How would you make the examination?
Mm, well, first I need to take the patient's heart, what was it called? Heart pressure? Yes, right.
Okay,
Uh-huh.
heart.
So so I will ask the patient to sit up, to sit down and put his arm still while I put ah, the what is it called? The
The
what is
sphygmomanometer.
it? Uh-huh, manometer. And then maybe, I mean, if I'm doing like an electrogram, AGK, electrocardiogram, I can tell the person to lay down in bed and put the arms
ECG.
and
Okay,
ECG, I'm
but
sorry.
vale. Just one thing. I'm asking you to explain or describe the examination. So after you take the personal details and everything that is on the anamnesis part, you have to
Mhm.
make the examination, right? Which kind of procedure you make to do that part?
What kind of procedure?
I mean, palpation, auscultation, which you have some steps,
Ah,
right, to do the examination. It's in general, maybe, and just in some cases you get into some specific details, right?
mhm.
Okay,
So,
I just wanted not to confuse you, okay?
uh-huh.
Just because of that.
So the examination will be come if I'm going to palpation. What was it? To
Yeah, imagine it's just that we are, as you were yesterday in classes, right?
yes, yes.
Okay. Uh, well, you saw the taking history part, then the examination, right?
Mm-hmm.
That was the explanation I was asking you to make, okay? But no worries. For the next time, I will ask you again. Okay.
Okay.
Okay,
Okay.
vale. Thank you so much. Take care.
Bye. See
See
you.
you on Monday. Okay?
See you Monday.
Bye bye.
Bye.
Hi, Mateo. Good evening.
No. Hi, teacher. Good evening.
Good evening. Now I can hear you. Okay, Mateo, I will ask you please to choose at least three common conditions and make some notes of your patients, imagining that they are describing the pain they feel about that conditions.
Okay. So maybe gastroesophageal reflux. The patients would come to the office referring like a burning pain in the chest, often after meals. Some and a bitter taste in the back of the throat. Some episodes of dry cough, and sometimes they may present dental affections too.
Okay.
That is one. That's the most common presentation. That is one. Then I don't know, deep venous thrombosis. Patients come referring a pain in the legs, more often in the legs. Sometimes they have some varices, and they feel pain when someone presses or compress the leg at the affected zone. Other condition, I don't know, maybe a generalized anemia. They come in with referring that they fatigue easily. They can't do the same exercise they did before. They are less motivated to do the things. They just want to rest. Sometimes in women, yeah, the menstrual cycle can be affected.
Okay.
And they note themselves as more pale than before.
Okay. But how did they go to your consultation? They say, I feel pain in some areas or place?
For the most common types of anemia, no. They just are like tired all the time. They don't have. They are fatigued. They uh, they can't resist the exercise. They feel like the heart runs faster when with poor exercise, like something's happening, tiredness. That's the most common presentation. That's
Okay.
sometimes other more specific features in other types of anemia too.
Okay. Can you choose another disease and make medical history?
Okay. So would be maybe 65-year-old man that comes to the consultation, revealing that he has increased thirst.
Mhm.
He is more hungry than usual. He has lost weight and goes to the to urinate more frequently, and I don't know. He has a wound in the feet that doesn't heal properly,
Mhm.
so he wants a complete evaluation. In the physical examination, or come on, then this is the anamnesis part. So the personal antecedents,
Mhm.
the past history, personal history is like his he had I don't know, he has smoked for 20 years, a package of cigarettes a week for 20 years. Then yeah, then these are unremarkable features.
Mhm.
Family history. He has his father with diabetes, and an elder brother that has some uh, sugar in blood problems too, but he's not sure what it is. Mm, and personal habits. He would he has a non-balanced diet because he's at work and during work hours he would eat whatever it comes to the hand, mostly uh, junk food like hamburgers or donuts or high caloric food. Mm, on physical examination, he takes no medications and has no no previous surgeries,
Allergies?
has no allergies, has no addictions, drink alcohol socially.
Mhm.
No, very much it. Um, in physical examination,
Mhm.
there is a man with a BMI of 29 um, kilograms per square meter. So he's overweighted, and um, okay. In head, we can distinguish gray discoloration of the neck, maybe with some changes in the texture of the skin. It's more scaly, more rough than the rest of the skin. Um, and cardiopulmonary examination is unremarkable. Um, Abdomen examination is remarkable too. And when we go to the limbs examination, we can observe the wound in the anterior aspect of the leg, and we can see that it's an active wound that doesn't heal. Is not with a scare. I don't know how was the word for that heart plaque that generates when you have a wound, and sometimes
the
another
you mean
the medical word is
Craster?
Craster. I
I
don't remember.
forget.
It's a more informal word. I don't remember, but it also can be said as costrate. I think costrate. I think. Well, the thing is
Crust.
crust.
I think it's crust. Yeah.
I think you're right. So
Yeah, I forgot.
So it doesn't. I don't observe a crust, and on neurologic examination, we can evidence that there is a loss of sensational to vibratory stimulus, and decreased pain sensation around the wound. So we ask for biochemistry and blood laboratories in exams. Blood is all right, nothing remarkable, and biochemistry is he has glycosylated hemoglobin elevated, and random glucemia, random glucemia over 200 milligrams per deciliter. So we make a diagnosis of, or a from diagnosis of diabetes mellitus type 2.
Okay. Okay, that was really complete. We don't have time for the other question. That was good. That was really good. Maybe just something fast while you answer my questionnaire. For any kind of procedure you want, maybe you can explain your patient or guide your patient, make directions to do so.
Yeah, it's a must. You must explain your patient during examinations, because you are having physical contact with the patient. So if you don't say like, no, I'm gonna touch your buttock or something like that, the patient may be scared, and the whole relationship physician patient is disrupted at that time.
Yes, I agree with you. Okay, so that's all. Thank you so much, Mateo. Just
Thank you,
to
teacher.
tell you that maybe next week I will have some trouble with the schedule, so I will tell you on the group. But maybe I want you to know that we can have the theoretical class, and after that I will divide in two groups like the last time, if you remember. Okay, and just prepare in time. Okay. Okay, thank you so much. Take care. Have a
Thanks,
great
teacher.
day.
Have a
See
good
you
night
on
too.
Monday.
Bye.
Bye-bye. Bye-bye. Hi, Melanie. Good evening.
Hi, Miss.
How are you? Mhm.
I'm good, thank you.
Okay, that's really good. Melanie, can you choose at least 3 conditions and make a note for the patients that maybe are describing how they feel about that?
Oh, three condition, for example, it's very common. I think that everybody have maybe in one moment in the life gastritis. For
Mhm,
example, they describe the pain in the stomach that it's ubicated in the upper of the abdomen. This kind of pain is like burning. It's a burning pain. They usually feel that they are very full when they just eat the half of for example, the breakfast. So they full very quickly for the inflammation of the stomach. They usually uh, feel to the nausea or include in some cases they m- vomiting. I don't know,
okay. Yeah.
vomit the food, and when they have the pain, the burning pain, they can have a head pain too. And it's not several, but maybe for it's very um, in related with this kind of pain. Three condition.
Mhm,
Other condition that it's common, for example, is the asthma. And this patient, even the child, for example, they have a cough and they have difficult to breathe, and usually these cases it's most important and most severe in the night, so they can sleep very well. And they usually, well, we can hear the sibilancias. I don't remember how to say it. The
the siblings.
the siblings. It's a typical sign in the asthma. So they can breathe very well. They have pain in the chest, and they can sleep very well. Another condition that it's very common, it's, for example, the headache. Even in the most severe cases, the patient have the pain on one side of the head or including in both sides.
Mhm,
If the pain is very strong, they can have nausea or even vomited. Um, they usually they are sensitive with the light and
mhm.
the noise that are really high. For example, my mom have that. And the pain, they can drink maybe some analgesic, but it don't work very well. So I think that are the three. This is more most common.
Okay. Okay, that was good. And now can you make a social history of a patient you know or you have experienced with? Maybe you
Uh,
can ask questions to obtain the information. Imagine you are with the patient and you will ask some questions.
okay, and it's very common. Ask first about the personal information, the name, the age of the patient, where she or he lives, and if it's in maybe in the city or they are in the urban zones, if they have all the condition to live well, or maybe the house is not uh, doesn't have a good construction. they interfere with the health. We can ask about the word, if she or he have a word, and what it's about the word. It's maybe have some exposition for something maybe dangerous, or it's in home, or it's in the streets, I don't know. um, Later, the personal information we ask usually are more directed, so we ask about the reason that they come in the hospital. We ask about what kind of pain she or he have, um, uh, what is the maybe the medication that they are drinking. For example, if it's a woman, we can ask about if she have a child, or they are, or she's pregnant now. Um, Maybe um, desde cuándo? I don't remember how to say it in a question.
Since but what kind of question would you like to say?
For example, the pain or the symptom.
¿Qué clase de pregunta? ¿Desde cuándo?
O sea, yes, desde cuándo they have the
How many, how much time have you been feeling this pain?
how
Could be-
much time they've been feeling.
How much? Yes. How much time have you been feeling like this, or maybe feeling this pain?
Yes, that I think that it's one of the most important question. So we can think most faster that maybe what is the diagnosis. Just with the question, we can think or found the reason of all the disease. In some cases, maybe can be days or weeks, and in other cases, in principle, the old people say that the pain is include since years, so it depend of the patient. After the reason of all the disease, of all the narration, we ask about antecedents, the personal antecedents, and the family antecedents is important. If you maybe have a father or mother that died for cancer, for example. um, Maybe if in the family have some disease that are hereditary, that it's important too. Or if she or he have some allergic principle in the of some
Hereditary.
medication. Yes, allergic. If they have allergics in the family.
Hereditary is the correct word. Okay.
Yes, it's it. And after the question, we have all the physical examination that we first we have the inspection. We have to examine it with an order. If we start in the head, so we can maybe we can have exploration in depend of the patient. Maybe we are thinking about that the patient have problem in the kidneys, we can have the percussion. Or maybe if it's a respiratory disease, we can use we can maybe hear or the auscultation. Yes, that it's a principle in that cases. And finally, we can write the suspicious diagnosis, and have and prescribe the medication for the treatment.
Okay. Okay, that was good. Melanie, just one thing with the pronunciation, percussion. Okay?
Percussion.
Yes, just
Okay.
that thing. But that was good. That was very complete. Now I want you to imagine that you are examining some patient. So you have to give the directions to him. I mean, you have to go over the, or you have to sit down and I will do this while you feel this. You have to explain to your patient. Can you please?
Okay, I will try. For example, if, for example, the patient have asthma, I can say that please sit down and put the back right, no, sit correctly. So first I can see the backpack without clothes. So
Mhm.
I can do the inspection that the skin is good, clear, maybe without some kind of injuries in the skin. And I can uh, have the, oh, I remember how to say the stethoscope,
It's a
the
stethoscope. Yes. Yes, stethoscope.
the stethoscope. So I can, we, for example, here or do the auscultation. Uh, in the first step is to start in up the back. So we always compare one side, the left and the right. So I can tell the patient that please breathe. I don't know how to say it. Breathe, have a deep breath. Uh, yes,
Yes.
and slowly exhale. So
Mhm.
I can hear the both side of the back to hear the lung the left lung and the right lung, comparing the both side, and I can start download, ir bajando, hearing
Okay.
the lung. And after I can say it included, we always ask in the patient that you can see 33 in louder to hear the lung better. Maybe if we can found a, if, I don't know, a flame or something more, so the patient can say uh, words that maybe sounds like words that have the R,
Mhm.
33 in Spanish, or maybe ferrocarril. I don't know how to say it in English, something like that, because
Okay.
we want that vibration hearing in the lung. um Maybe after we can have we can do the percutation with one head. So I can tell you the patient that i I will touch him or touch her. So I put my hand in the back, and my other hand with one finger I can do a little stroke, a little golpe. So I
Okay.
can
Yes.
do the
A
application.
hit, a little
I
hit to
think
stroke.
a little stroke. Yes. And well, I think that was the most important, for example, in that kind of physical exploration. Yes.
Yes, that was good. That were good explanations. So I think the patient will understand better if we try to tell him what should he do and how would he feel, right? It would be better.
Yes. Mhm.
Okay, Mel. Thank you so much. I just will take a picture. Okay, and one more. And as I was telling to Mateo, maybe next week I will have some trouble with the schedule because I have to travel. But I was thinking that we can change the schedule. Maybe after the theoretical class on Monday, we can have I will divide it into groups, okay? And maybe we can have a practical class with one group, and then on Thursday, sorry, on Wednesday, we can have the other half. Okay, man? But I will
I
tell
think,
you with
yes,
the group. Okay, thank you
yes,
so
yes,
much.
no problem. Thank
Take
you
care
so much. Have
and
a good
see you
night.
on Monday.
Bye.
You too. Bye-bye.
Good evening, teacher.
Carlita, good evening. Okay, how are you? Can you listen to me?
Sorry. Fine. I
I
was
couldn't. Okay. Okay. Can you please choose 3 conditions and make a note, a kind of note or resume of how patients would describe the pain?
Precondition. Okay. First will be urinary infection.
Mhm.
As we saw before, the patient often become with discomfort at the moment to urinate, like maybe they go more frequently to the bathroom, and they have a discomfort in the moment that they urinate, and it depends what kind of urinary infection it would be high or low. In the case of high, they have a pain in the back, low back. Miss? Yes.
Mhm.
Other,
Uh-huh. Can you listen to me?
yes, now, yes. Miss?
To me, turn off my camera so we can have a better connection. Just
Okay.
for a few minutes, okay?
Okay.
Can you listen to me now?
Yes.
Okay, continue.
I think in this case of urinary infection, that's the principal reason for the people go to the doctor. Maybe if the infection is grave. ¿Cómo se dice grave? How can I say? Sorry. Me?
Heart infection in this case.
Heart? Okay. Thank you.
Can you listen to me?
Yes, now yes. But it is.
Okay,
And maybe
go ahead.
they can have a fever and other. I think that I'm talking about the urinary infection. I'm not sure what else. Another condition will be maybe headache or migraine And they often came with headache, and we have to, how can I say, dirigir? Miss?
We can, we have some directions.
Excuse me? I can't listen to you.
we can give some directions to the
Okay.
patient.
We
That's
can,
what you want to say?
yes, we can. O sea, I want to
Or
say,
we can lead, maybe.
excuse me?
We can lead the question.
Okay, we can lead the question giving the examples like if the pain where does the pain begin?
Mhm.
If it how can I say if it is irradiant? How can I say that? Irradiant? If it irradiant?
Okay. Well, I'm confirming. I don't know. I don't remember at this time, but continue.
Okay, if it will be if it goes to another part of the head, sorry,
Mhm.
and if the pain is throbbing, is that correct? Palpitante,
Yes, palpitating,
palpitating, and if
radiates.
it radiates. Thank you, Miss.
No, just with R, radiates.
Radiates. Thank you.
Okay.
Yes, I think we can, how can you dirigir? What did you say? Sorry, Miss.
To lead.
To lead. And the question to have more information from the patient because sometimes they can't explain your pain, their pain, sorry. Maybe another condition will be some infection, gastrointestinal infection.
Gastrointestinal infection. Yeah.
Yes, will be the pain or maybe the reason that they came to the is that pain, stomach ache, and also vomiting or nauseous.
No. Mhm.
And yes, we have to ask how the pain is, if and when did it start, and if the pain is like it burns, arde,
Burns. Okay.
or if it is like apretar. I don't know how to say that.
Mm. Okay, let me check.
Thank you.
Continue.
Okay, if it is like a retorcijón, I don't know how to say it to if he or she
To squeeze.
the squeeze
Squeeze.
is that for apretar, right?
Yes.
Squeeze. And retorcijón.
Squeeze. Retortijón.
Thank
Okay.
you. I'm going to take notes about that.
Yes. Okay. Cramp.
From?
Cramp. The first one is a squeeze.
Squeeze.
And the second one is cramp.
Okay. Thank you. So we can do a better diagnosis with those kind of questions. If he or she takes some medication to calm the pain, and if it calms the pain, and if the pain calm in some position or it agrava, correct?
Yeah.
In some other position, I think that, but we have to, I don't remember, dirigir
To lead.
the question. to have more information.
Okay. Lead.
Lead. Thank you.
Okay. That's good. And maybe you can give some instructions to your patient. Choose any kind of disease you want, and you have to make some examinations. So you have to lead your patient. You have to give some instructions.
Okay, maybe in the case of appendicitis,
Appendicitis.
in the appendicitis, we can do some maneuvers. How can I say that? Sorry, Miss.
Maneuvers.
Maneuvers, like, well, most of the maneuvers of appendicitis is, well, we do that. The doctor does the maneuvers. Sorry.
Maneuvers.
But we can ask if we can say that show me the pain. Where is the pain with a finger, where it goes, and I'm going to pressure
To apply
to apply
pressure
okay,
or pressure.
pressure.
Do you want to say to apply pressure?
Yes.
Okay.
And tell me where is the pain.
Okay.
And how it pain, how is what kind of pain is, and we can do maneuvers like psoas, maniobra de psoas.
Okay. So as maneuvers.
Psoas maneuver. In this case, we can tell the patient lie on your left side.
Mm-hmm.
And extend your right leg toward your back.
Okay.
Also, we can see if the patient has pain sorry, in the area that we have. Another, I think that, but most of the maneuvers in this case, we do that.
Okay. Okay, that's good. That was good. Let me put my camera on. I hope you can listen to me afterwards. Okay. Yeah, that was good, Carlita. It's really important that we can have that we can use all of these words, new words that we find out. Okay.
Okay.
So please practice. It will be so good to have this on your vocabulary because you can explain better to your patient.
Yes.
Okay.
Thank you. I have well, I want to say that on Wednesday, next Wednesday, I have a surgery in the morning, and I want to ask if I can to be present in the class or in the evening, but I'm not going to participate because the surgery is in my nose.
Oh, okay. You will have the surgery. Okay.
Yes, and I don't know if I am going good to participate, but
Okay, no worries.
I can listen.
No worries. You have to rest. Okay. I will put a license to that day. The trouble with that is that the next weekend I will have some trouble with my schedule because I have to travel.
Okay.
I was thinking maybe that I can have the class, the theoretical class on Wednesday, and after all, I can have the practical class. So dividing you on two groups for which is that for Monday's class, for Monday's theoretical class, okay? Like the last time, remember?
Yes.
One half on Monday, the other half on Wednesday after
Yes.
the theoretical class.
Mhm.
and the other for the Wednesday would be on Saturday. Okay.
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 I
I would put on the group, but otherwise you have the license, so don't worry. For the theoretical class or the practice for Monday, you can be there, and on Wednesday you rest. And then for the theoretical Wednesday, you can see the record, and then come on Saturday. Okay.
okay. Thank you, Miss.
Okay. No worries. Take care. And okay, Carlita.
Okay. Okay. Thank you, Miss. I have problems with my connection, I think.
See you, man.
See
Take
you,
care.
see you tomorrow.
Okay, no worries.
Okay. Bye.
Bye bye. See you on Monday. To me, maybe we have some troubles with the connection.
Hi, teacher. Good evening.
Hi, can you listen to me well?
Yes, teacher.
Okay. Okay, that's good. Well, let's continue then. As you were listening, well, I will tell you that maybe for the next week, I will have some troubles with my schedules. So I will ask you to take the class on Monday, the theoretical class, and I will divide you into groups like the last time. Remember, after the theoretical class, we have the practical class with the half of the group, and the other half will be on Wednesday after the theoretical class. Okay? Can you listen to me? Okay. And for Wednesday, theoretical class would be on Saturday. Please, just for this time. Because on Monday, from this to the next, I think 15, maybe we will have the final, right?
And 15?
Yes. Next week is our last week.
Oh, okay, teacher.
And then it would be the final.
Oh, okay, teacher. Okay.
Okay. And have this change.
Teacher, sorry, I can't
Okay.
hear you very well.
Okay. I just turned off my camera so you can listen better. Now you can?
Yes, a little bit. I can hear you.
Okay. Okay, you won't see me, but I'm here.
Okay. Just I'm sorry because I have a bit of a cold today and I can't speak very loud.
No worries. I can understand. Okay, Jethro, can you choose at least 3 common conditions, and you can tell me how your patients would describe the pain or what they feel when they go to your consultation.
Okay, conditions. Maybe one of them can be gastritis. That's right, the pronunciation.
Yes, gastritis, that's good.
Gastritis. And maybe the patients can say and can refer a pain in the pit of the stomach,
Mm-hmm.
and that pain can burns and maybe that worsens with foods like potatoes,
Okay.
bread, and sometimes they can present I don't know how to say reflujo in English. Reflujo, como refieren como yeah,
Okay.
reflujo gastroesofágico. I don't know how to say that.
Okay, let me check. Reflux. I think, but I don't know. Yes, reflux.
Okay, thank you. Have reflux, right? Okay, maybe I think this one of the important symptoms in this condition.
Sorry, just one thing. The correct pronunciation is reflux.
Reflux.
Yes.
Thank you so
Okay.
much.
No worries.
Maybe another one condition will be urinary tract infection.
Okay.
The patients can say I have burning with the urination. I think
Mhm.
one of more important symptoms in this disease. And maybe this condition is more common in the women, right? And maybe she can tell the doctor,
Mhm.
I go to the bathroom more often, maybe in the night, right? More often, maybe the patient can present to fever and vomits, nausea, and how to say escalofríos?
Um, let me check. Okay, continue.
Okay, maybe this one is more important to in this condition. Another one could be appendicitis too. In this disease, the pain starts in the pit of the stomach too. Shaking, chills, right?
Chicken chills. Yeah.
Shaking, chills. Okay, thank you.
Just one thing. Stomach. Remember, headache, stomach ache, stomach. Okay.
Okay, stomach.
Mm-hmm.
Okay,
Okay.
again, sorry, so the appendicitis. The pain that starts in the pit of the stomach and migrates right iliac fossa, right? I don't know, but yeah, the right iliac fossa. There may be nausea, vomits, fever, and lack of appetite too. And
Okay.
these conditions with the pain starts in the pit of the stomach and go to the iliac fossa, right iliac fossa, sorry.
Mm-hmm.
And the name of this condition is, I don't know how to say this, but it's cronología de Murphy. I don't know how to say it.
Muras. It's a proper name.
Sí, cronología de Murphy is the name in Spanish.
The Moors. Moors chronology.
Morse chronology.
Yeah.
Okay, the name of this condition is Morse chronology, right? With the pain starts in the pit of the stomach and goes to the right iliac fossa. I think these are more common conditions like gastritis, urinary tract infection, and appendicitis.
Okay. Okay, that was good, Jethro. And now, can you describe or make a social history of a patient you already know, maybe?
Sorry, teacher, can you repeat, please?
Yes, can you make a social history of a patient you already know? What questions would you ask to obtain the information?
With what condition? What disease, teacher? I don't understand.
Choose any patient you already saw on your experience and make a social history with it. Maybe you can imagine that you are in front of your patient and make some questions that you would ask to obtain the information you want. for this social history?
Okay, maybe I choose maybe urinary tract infection.
Okay.
Okay, the first one I can ask to my patient is the first one. Do you present burning? Well, because in medical terminology, it's dysuria, right? I think it's the same.
Mhm.
That maybe I can say, my patient, do you present burning when you go to the bathroom? To Yeah, maybe when you go to the bathroom, maybe um, maybe mm, you go to the bathroom more often. That one of the questions important too.
Mhm.
Fever and the last days of these days, do you present fever? Maybe do you present vomits too? And if you if you have a urinary tract infection and these last months or in the year is common, or is the first one do you present these symptoms, right? Maybe
Uh-huh.
add to if you have how many oh no, oh damn, se me fue. Parejas sexuales.
Sexual partners?
Oh, so yeah, sexual partners you have.
Mhm.
That will be important too.
Okay. Okay, yes, that is what you are describing for a social history, right? And it's good. Maybe if they generally use other bathrooms that are no, I don't know,
Bathrooms, maybe?
so clean or something like that in that case, to recommend the patient not to use them anymore or to be careful, right?
Yes, and maybe I think that's important too. If maybe I don't know, some women use the same soap. So that's good pronunciation for soap. Jabón.
Soup,
Sorry,
no
those
worries.
women can use the same soap they use to the body and the that's right, genital,
Yeah,
genital
genitally. Yes, genital area.
area, and that's one of, I don't know, se altera el pH, se llama, altera el pH de la vagina. So that
Yes. Um, it causes changes or alteration on the
pH
vagina pH.
of the
Yes,
pH. And I think
yes.
it's important because they can use the same soap for a lot of things. And that's one of the important questions of she use some soap or what for cleaning the genital area.
Okay, okay, yeah, that's good, and that's a good advice. Okay, Jethro, and it was so good and very complete. I will send to you my questionnaire.
Okay, gotcha.
Please fill it for me, and I will take a picture. I don't know where am I. Okay. Okay, that was good, Jethro. And remember what I was telling you about the next classes, okay?
Okay, when I can, the morning can choose the schedules for.
I will put on the group, and then you will choose the schedules for Monday and Wednesday after the theoretical classes. Okay?
Okay, okay, teacher.
Okay, thank you so much. You on Monday.
Okay, teacher. Thank you.
Take
Bye.
care. Bye bye. Hi, Jorge. Good evening.
Hello, good evening. I think your internet connection is a little
Okay.
bit. Yep.
Yes, that's why I'm going to turn off my camera, okay?
Oh, no problem. It's okay, no problem.
Okay, thank you. Okay, Jorge, and can you choose at least 3 common conditions and make like a little note of how patients would describe the pain?
Okay. Um, okay, 3 conditions. First, let's talk about, I don't know, normal headache regarding migraine, for example, is really common.
Yes. Yes.
Okay. So patients with migraine are going to express their situation with, of course, first headache. The headache is, I think, the most important thing that outstands in this kind of patients.
Mhm.
The way of how it hurts is a cluster headache. Also, the patient is some patients are going to be like annoyed by light.
Mhm.
Also, patients sometimes feel nausea or they also feel like vomiting. And when you ask the patient about what happened, it relates frequently with stress situations. And also, the part of nutrition is really important because all fatty food is the one that triggers this kind of pain in patients. Sometimes also the family history is important because for example, parents or sibling with this situation are related to the patient situation because migraines are also a irritation over the brain, and it's really important to know about that. For example, I don't know, parents with maybe the mother or the father with epilepsy is an important information for the diagnosis.
Okay. Okay, Jorge, that was good.
Okay.
Um, now you can choose any other condition, maybe
Okay.
of a patient you already know, and make a social history. Maybe you can ask questions to obtain the information.
Okay. For example, today I saw a patient. This case was not that huge amount of information because the patient had uh, a brain, well, actually a school trauma because he fell from a horse. And what I asked first is I face the patient and I tell him what's your name, uh what's your full name, so I can understand if he or she, in this case he, so I can understand if this patient is like is awakened, is like his mind is fresh, he's
Mhm.
not dealing with any deep trouble in the brain. Okay, so after he told me his name, I asked him what happened. And he told me that he has a terrible headache. After that, I asked him why, how did it start? And he told me that he fell from a horse. He explained me how was the fall. He hit like the posterior part of his head,
Uh-huh.
and he lost conscious
Wow,
at that
how
time.
dangerous.
Yeah.
Okay.
So after knowing that, I already asked for a CT scan. So after that, I asked the patient. In this case, I didn't because I know, as I told you, I know many things. And this is a trauma, so there is no like comorbidities with our staff. But you
Mm.
always asking nowadays, for example, respiratory system due to COVID stuff.
Mhm.
Also, also you have to ask. Yeah, you have to ask about everything always. Yeah, just I'm just um For example, I don't know if he has some other bleedings, because I saw his labs today, and his blood count regarding the red blood cells was low. Apparently, this patient had anemia, and it was microcytic hypochromic anemia. So it sometimes is related for bleeding. So I asked the patient if he had any any uh, um I don't know, if he shown blood
Hemorrhage?
while excuse me.
Oh, sorry. Continue. I was
Oh,
telling you an hemorrhage or something
oh
like
yeah,
that.
thank you. Exactly, yeah. An hemorrhage after passing stools. How was he passing water? Um, I asked him, yeah, all the stuff, if he had some other places of the skin that he had, like for example, heat. I mean the whole body, and it was almost the most important thing was the head. So after watching the CT scan, there was epidural hematome, and
Mhm.
also there was intracerebral hematome. But the patient only refers headache, so that's a good good and a bad prognosis for him. Good one because he doesn't show any other motor symptom. For example, he's moving legs and arms very well. A little bit in a little bit regarding the tendon, the deep tendon reflexes, they're a little bit high as normal, but it happens. There's some brain edema also, and I say bad because intracerebral hematoma shouldn't be that painful as he's feeling. So he's under observation. He's admitted to the hospital right now, and yeah, I think that's it.
Okay. I have a question here.
Mhm.
I'm curious about the clots maybe that can appear after the hit or the stroke. It can appear a few days later, not immediately.
Yes, in this case,
Mhm.
as it was like 2 days ago, I think his fall was 2 days ago,
Uh-huh.
and the heat was 2 days ago. It takes time. It takes like
Mm,
around 1 or 2 weeks to make a clot. But as the brain is not that like a dry surface, a dry organ, um, most of the times the clot, in this case, or the blood right now, is not a clot yet. It like reabsorbs itself. So that's
oh,
what we're looking for. So it does not, it's like, how can I explain? For example, you see here, this is like the bleeding, and around the bleeding, there's edema because it was a posterior hit,
mhm.
and the the hematome is anterior, and that's interesting
Oh,
because yeah, it explains like how it happened, because it was a posterior hit. It's like the brain did something like that, and it was the
something
school
hit
that damaged the
front.
tissue, the brain tissue. And yeah, that's something
Okay.
interesting that happens. There is epidural hematome in the posterior part, but the most important is the anterior one. That was because and after the first hit, it was like bouncing off the brain and hit the skull.
Okay. That's interesting.
Yeah, it's
I
really
didn't
interesting.
know that. Okay. Jorge, I I learned a new thing. New things always we speak.
Yeah, yeah,
Okay.
yeah. There's something interesting to learn together always.
Yes. And well, continuing, maybe you can choose, um, I don't know, maybe some disease and you want to make an examination. So you have to give instructions to your patient. How would you tell them how to
Perfect.
act?
Okay. In this case, for example, I also can use this patient. Maybe
Mhm.
I didn't know him. So I also want to check about the brain integrity, doing several examinations. For example, there's one kind of examination we do very frequently. It is we ask the patient to close his eyes and to extend both hands to the front, close his eyes, and we can see if the patient loses like the gait, he has in this case an unstable gait. We think about cerebellar damage, because that's what gives us like an straight gait. Also, I can ask the patient to, for example, extend both arms laterally and touch the nose, like repeating it. So it like give us a glance of the perception of the space of the patient. We also ask him to close his eyes and do this like several times. Also, we can search in a patient, in this case a sitting patient, and for example, with both arms flexed, do like show his palm, and after that the dorsal part of the hand, like I don't know how to explain, like for example, right hand palm up and left hand palm down, and switch them all the time. That is another test that gives us also the coordination of the patient. What else? We also tell the patient sometimes when there is intracerebral hematoma, we ask him to, for example, we show an image. We show an image with a, let's say, like a story, like a short story image. For example, you see, I don't know, two kids playing basketball, for example, and you ask the patient, you tell him, okay, explain me and describe the picture. And when the patient describes well the picture, of course, everything is cool. Sometimes we can see damage when the patient does not have the ability to explain the picture with certain words. For example, he can say, okay, the two kids playing, and it doesn't have coherence. So we understand that there is damage on the brain. Or the patient might explain another thing that it is not in the image.
Okay.
The patient can explain like, I don't know, there is two dogs that are running from, or they're running after a cat, I don't know, something like that. And that's important to know if specifically the place of the damage, you know, the specific part of the brain that has been damaged.
Okay, that's so interesting.
Oh, thank you.
Yeah. And is it reversible?
Depends on the case. Depends on the case of the patient. Depends the age also. Depends the place. How is the damage? How was the damage? What kind of lesion is it? There are a lot of things to think before you can say it's going to have a good or a bad prognosis. You have to check if it is surgical or not. Yeah, there are a lot of things to think if it's reversible or not.
Okay, Jorge, thank you so much.
Oh, thank you.
That was so good. And I will send to you my questionnaire.
Okay,
I don't
perfect.
know if you can see it.
Yes.
And of course, I will explain to you that next week
Yes.
I will have some trouble with my schedules.
Okay.
That's why I was asking you, your classmates, to maybe have the theoretical class and then divide into groups like the last time, remember?
Yes.
And the class or the practical class from Wednesday,
Yes.
maybe take it on Saturday.
Okay.
If it's possible. Okay, but I
Yes.
will put it on the group so you can understand better and maybe choose your schedules. Okay.
Perfect. No problem.
Okay, thank you so much. Oh,
Well, thank you.
just one more picture and
Okay.
we'll let you go. And thank you so much.
Thank you. Have a great weekend.
And see you Monday.
See you Monday.
You too. Bye
Goodbye.
bye.
Thank you.
Hi, Rina. Good evening.
Hello, teacher. Good evening.
I have some trouble with my internet. I don't know. Well, let's try, okay? Can you
Okay.
turn camera? But if it's happening something with the connection, I will turn off my camera, okay?
Okay.
Can you listen to me?
Yes, teacher. I can hear you.
Okay, with a little delay. I will have to turn off my camera, okay?
Okay.
Okay, sorry. Well, can you choose 3 common conditions and make a little note or describe for me how patients would tell you about the pain they feel?
You asked me 3 conditions.
Yes.
Yes.
Imagine you have your patients, okay? They are going to your consultation and they are telling you, look, I feel bad, I feel sick, I have this, and I don't feel well, and everything. So how would your patients go to your consultation into those kind of or into those 3 conditions you choose?
Well, the patient has the 3 conditions that the patient that I have. Well, that I don't get it about the question. It's about the when patient consult me about everything or in a specific illness.
Yes, I want you to choose 3 conditions, okay? And
Mhm.
imagine your patients going to your consultation are telling you how they feel. So you can describe to me.
Oh, I can hear you, teacher. I lost you.
Oh no. Okay, describe how would a patient go to your consultation in 3 different conditions.
About the condition, how the patient comes to me.
Yes.
Well, the first condition is the patient has are some symptom or illness that the patient in that moment he is able to support or to handle it, and the patient comes to me conscious oriented and can speak and can handle in a conversation with me. That is the another condition is when the patient when the person comes to me and with a urgent condition, or for example the person has a terrible migraine or has a terrible pain that that is difficult handle and a communication with him. And another condition is about when the patient comes in a emergency room and the patient how the patient is unconscious, and I have to talk and get the information with the assistants or relatives comes to the patients.
Okay. Okay, those are the 3 conditions?
The another condition is the age of the patient. If the patient is a kid or a children that cannot communicate with them, I have to talk with the parents or the relatives. That is another condition. And another, it's about another age, a senior, for example, who has a problem about the memory or some condition in the mental health that make a problem about the communication.
Okay, when I was telling you a condition, I mean a disease, any kind of disease. For example, a headache or maybe a migraine or appendicitis. How would the patient go to your consultation? That's why I was giving you the example of a patient who goes and I feel sick, I feel nauseous, I have this trouble and those kind of things.
Okay. I think about the first communication with the patient. I think about the triage when you told
Okay,
me
no
that.
worries, no worries. That's good. It's good too because it's important, right? We
Okay.
saw it yesterday, so it's good. But now, can you describe it to me?
Okay. In a ordinary, in another, or the common illness is about the pain in the famous pain in the stomach that the patient told. When the patient comes, in a situation, one situation when the person comes to consult or because having a pain in the stomach, that is usually the person. When I ask about what is the reason for comes, the person usually say I having a problem in the stomach, or that is the more common, I having a pain in the stomach. But the stomach for the patient is all the abdominal area, not specific the stomach. So if the patient have in a if the patient has in a tolerate pain, un dolor tolerable, I can continue.
Tolerable.
Okay, if the
That's good.
patient has a tolerate pain, I can ask or I can make questions about what the specific area that the patient has, or what is the specific area that you have a pain, or about the area or the patient have to tell us about the point me what part of the stomach have pain. Another is about the area. I can ask about if the patient or if you have a diarrhea and how much or what times go to the bathroom, for example. If the patient has diarrhea, yes, about the smell, about the appearance, what is the common questions. If the patient take some medication, that is another common. If the person has, or have you feel flats? I don't know is the name.
Yes,
About
it's
flats.
good.
Okay.
Yes.
And
or you're meaning fart?
Fart. That's right,
Fart.
teacher. Fart.
Yeah.
And about the appetite, or another question, it's about what is the last you eat, or if you have a hungry or you lost the appetite, for example, there is another question. Or if the travel, if you or have you traveled some country for the typical illness about the country. That is one reason commonly that the person go to the clinic, for example, for the pain abdominal. Yes.
Okay, that's good. Just a few things. Abdominal pain.
Abdominal pain.
Okay.
Okay.
Consultation is the other one. And let me check. When you said point me, it's better if you said show me where is your pain or where. Do you hear me?
No, teacher, I lost you when you
Not
told
the
me
last part?
show. Show, and after that I can hear you.
Okay. Okay, no worries. Show me where is the pain you feel, or show me where is the place you feel pain. Okay,
Okay.
it's better. Okay, but that was so good and always complete, Rina. Always complete.
Thank you.
So that's good. You make yourself understand. It's just your pronunciation that we have to work, but you're getting better. I mean, you're how can I say? Well, it's getting better, okay? So no
Okay.
worries. But the pronunciation, just that thing. Maybe I don't know if you have Spotify. Well, you use YouTube.
Uh, some occasion only when I have to make a class.
Okay. Maybe you can use YouTube to put the letters of some topics you want to know, maybe medicine, it could be, and listen at the same time in the language, in the English language, and it will help you a lot with the pronunciation. Okay?
Okay, teacher.
Okay. And I don't know if you can see my questionnaire, please.
Yeah. Yes, teacher.
Okay, fill it for
Okay.
me, please. Thank you. Rina, next week I will have some trouble with the schedules. Okay, and I was telling your classmates that maybe we can make it like the last time, dividing into groups and having two classes after the theoretical classes and one on Saturday. Okay? Can it be possible for you?
What day, teacher? Only Saturday.
Yes. I mean, I will divide it into groups after the theoretical classes, one group on Monday and Wednesday, the other half. And for the theoretical class from Wednesday, maybe it will be on Saturday morning, okay?
That's okay, teacher. If the practice is after the theoretical, I don't have problem.
Okay, that would be better. It would help me so much. Okay, Irina, I will write it down on the group so you can understand better and so you can choose your schedules too, to be fair enough with everybody, okay? But it will be tomorrow maybe, okay? See you on Monday.
See you Monday, teacher.
Take care. Have a great weekend.
Thank you.
Hi, Ale. Good evening.
Hi, teacher. Good evening.
Ale, I have some trouble with my connection, so I will maintain my camera off, please,
Okay.
just for this time.
Yes,
But
teacher, no problem.
I'm here, you know. Okay, let's talk about the topics we saw yesterday. Maybe you can choose 3 common conditions and make like a note of how patients would describe the pain they feel.
Okay. About pain. Okay. We will divide the pain in two places, those two things, the sudden pain and the chronic pain. With sudden pain is the most common, and the patients describe like I have a colic pain, or I have a pain in my I don't know, abdomen, or have a stomach ache, I have a headache, and we have to try to have more details about the pain. We use in mnemotechnic, or I don't know if the correct word for mnemotechnics.
Okay.
We use the name Alicia in Spanish.
Alice in English, I don't know.
Alice. Oh, yes. A is the appearance. Maybe is immediately sudden, or is more progressive. The location, the patient say I have a stomach ache, or I have a headache. The patient described the location. The intensity. We use a lot of scales, but the most common is the numbers scales. One is the less pain, and 10 is the highest.
Scales.
Sorry, did you?
Scales.
Scales?
The correct pronunciation would be scales. Yeah.
Scales?
Yes.
Okay. And the number 10 is the most painful pain. Later we have the character or type of the pain. And sometimes it's a colic pain, other maybe a thrombin, other a burning pain. Later the irradiation. Sometimes the patients feel pain in other sides. For example, in cholecystitis, the patients feel a colic pain in the right upper quadrant and in the back of the same side too. The last is the attenuation. If the pain disappears with some drugs or some positions. Later we have the chronic pain. The patient described this like, well, in this case, the patient have a diagnostic. For example, the migraine. I don't know if it's correct. They know the diagnostic.
Oh, sorry, migraine.
Migraine. Okay. They have a episodial headache. They describe in this case some phenomena
Yes.
for her disease, and in other things or in other patients, they describe a pain that is not so high and sometimes, but is continuously is and sometimes is progressive. And in this kind of patients is hard the treatment, and sometimes we need the algologist, the special, the doctor who has a specialty in throat pain, or the anestheticians.
Okay, yeah, anesthetician. Yes, that's okay.
Yeah, I don't know, but
Okay.
I said no.
No, it's okay. That's a good thing. It was complete. I was asking you to choose 3 conditions. Like when your patients go to your consultation, they go like, I'm sorry, I feel sick, I have this pain and this.
Okay.
Maybe you
Okay.
get into okay. Maybe you can tell me about 2 or 3 if you want.
Okay, the cholecystitis. They feel a colic pain in the right upper quadrant and have signs and symptoms like vomits, nauseous, and that have some characteristics. The migraine in this kind of patients have pain in just one side of the face or head, with I don't know, phenomena. Maybe the light hurt she or he, and some food maybe can start the episode, like lactose.
Yeah.
Smoke, or a lot of red bread. I don't know. Carnes rojas.
Red meat.
Red meat. Yes. Thank you. And the classical flu. The patients, they have a cough. I have a cough. I have a sore throat. Maybe have a sinusitis too, and have a characteristic pain in the face. The a central pain. Yeah. That's all.
Okay, that's good. Can you make a social history of a patient you already know?
A social history. Maybe that is similar to the no pathological antecedents here, and we have to know here. We put the grade if the patient finished the high school or maybe finished the university, have do some report, the religion,
Sport.
sport, yes. If the religion, because in some patients they don't want the blood transfusion, they don't permit that. The I don't remember. The house is have the complete. I don't know how to explain this. The basic things
Yes.
like water, electricity, that kind of things, and if live in our owner house or rent a house or department, if live with someone else or live alone, because in this case is important to know, because we can see more depression in patients that live alone. I don't remember more things.
Okay, that's good. It was good. And now I want you please to give some indications. Imagine you have a patient and you have to give or make an examination. Okay, and you have to give instruction to your patient.
Okay. I don't know. Okay, move to the right side or put your body in your right side. And I can examine the left side in this case. Move or put your head backward in case of nose examination. I don't know. Right there in upper limbs examination.
Okay. Okay, Alex, it was good. It was good. It was complete too. Okay, and I was asking you maybe if I have a trouble with my schedule next week. Okay, so I have to apply the same tactic like last few weeks, where I have the theoretical classes with you on Monday and Wednesday, but the practical classes will go in two groups for the class of Monday.
Okay.
On Mondays after the theoretical, on Wednesday after the theoretical. And the classes from theoretical Wednesday will go to Saturday, okay?
Okay. We changed the Monday classes. I don't
Yeah,
understand very.
just the practical classes, like the last week, remember? Just the practical. We have the theoretical as common on Monday and Wednesday, but the practical classes would be on
Sorry.
groups with the first one, like on Monday after practical and Wednesday, and the second will be on Saturday. Yeah. Okay.
Okay. Yes.
Okay.
Um.
Okay. Thank you so much, Alex. Can you
Okay.
fill my questionnaire?
Yes. We talk about the practical classes on Monday, I suppose, ¿verdad? True?
I will, no, I will write it down on the group tomorrow so you can understand better, and you can, of course, pick up your schedules to be fair enough with everybody, and then we will decide. Okay.
Okay. Okay, teacher.
Okay. Thank you so much. It was just to let you know. So see you on Monday, and tomorrow we will talk.
Okay, teacher. See you on Monday. Have a good weekend.
Okay. You too. Bye-bye.
Bye.
Hi, Andres. Good evening.
Good evening, teacher.
How are you? I'm so sorry I have my camera off, but I have some trouble with my connection, so it would be better if it's off, okay?
Okay.
Okay, thank you so much. And I will ask you, please, to choose 3 conditions and make a note of how patients would describe the pain they feel into these 3 conditions.
3 conditions and explain how patient feels.
Yeah, choose 3 conditions and how the patients would explain to you how they feel.
Well, one, for example, hypertension. The patients, when the patient has hypertension, always patient says to doctors that they have dolor de cabeza.
Headache.
They have headache, pain in some part of the body, for example, head, and the neck, or other parts. For example, they have pain in the eyes, difficulty to concentrate in their activities, and other condition that I heard with my doctors, for example, and diabetes. Diabetes is so common. The patient explain their symptoms like pain in the food, bad nutrition. Some patients can say that has they have much sleep o muchas ganas de dormir.
They are tired. They have tiredness.
Yes, they are tiredness. They go to bathroom all time. The 3 condition, it's I believe dengue. Dengue is so common too in Santa Cruz. It's a tropical disease. The patients can say they have muscular pain, headache. It's the patient feels tired. It's the patient has dehydration.
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 Okay. Okay. I'm so sorry. We have a little delay. Okay, that was good. Just one thing. Tiredness.
Tiredness.
Okay. Yes. And well, can you make a social history of a patient you choose? And maybe you can make some questions you would ask to obtain the information.
Well, I never do a social history, but I know that the normal question in for patients is, for example, uh, how do you feel in the last week or in the last time? Where do you work? If the patient has family, if has sister, or if the patient has sons. Maybe I ask about the insurance. If has
That was you telling yesterday, right?
yes, if has, for example, or if the war has like en la Caja Nacional or other type of insurance. Yeah, like that.
Okay. Didn't you ask your patients if they drink or if they smoke?
Yes, yes. It's important to for example, one person in the class says if the patient drink or if the patient consume drugs, for example, it's important to.
But you think it's important?
Yes, I think it's important uh, because I know some persons in the university that consume this type of of, of elements.
Substance, okay. Okay, but to diagnose a patient, maybe, or to know with what is making him feel worse, and what is the thing that they have to put off, maybe it's important to ask the patient the social history, right? Like these questions. For example, do you smoke or do you drink? How much every single day? Or maybe he says, no, socially. Okay, it's not such a big deal. But you already know the details, and then you will make a diagnosis. And if it's good for your patient to cut off that kind of habits, right? And you will suggest maybe that he won't do it anymore. Okay, so as you can see, social history is really important. You have to do it. Andres, I know you do it. Maybe you're getting confused here. Okay. Okay. Well, maybe now you can explain. Maybe you have a patient, choose any condition or illness, and give some instructions to your patient of how would you make an examination of any kind of examination.
Well, if for example for dengue, I'm yeah for I believe that if I have a patient with dengue, I have some laboratories
Lab tests.
sorry,
Lab tests.
lab tests. Some lab tests explain to patients what is their conditions, maybe has some recommendations, for example, drink much water, or some drinks like power, or other drinks. Yeah, like that. Frequently ask about how they feel. I believe that it's correct. Try to demonstrate to patient that it's important. Care their health.
Okay, to take care of their health. But here, the instruction were that you pick up a disease, maybe, and you have to give instruction to your patients. For example, someone who comes to your consultation and tells you that he is feeling sick of the stomach. So what is the first thing you would tell him? Where do you feel the pain exactly, right? And he will indicate you. And then you maybe will say, okay, I will touch this place, and you will tell me if it feels so bad or maybe not so much pain. And the patient will follow your instructions. That's what I want you from you.
In instructions. For stomach, for example, I believe that it's try to not eat some foods like I don't know, for example, hamburger or.
But Andres, when a patient is feeling like, for example, has a panic attack, what would be your instructions? You have to say to the patient, please calm down, breathe deeply as you can, then contain the air, and then breathe out, right? It would be one instruction. Okay, it's just an example. You have to give instructions to your patient. Choose any kind of disease and tell me what kind of instructions you will make.
Well, for hypertension, for example, the instruction.
Okay.
Well, for hypertension, the instruction that I have, it, for example, take controls in the pharmacy. Try to take the medication.
That are recommendations. Those are recommendations. Giving instructions is when, for example, your patient, you're giving them a medication, okay? The instructions would be, you have to take the pill once a day, just at the half of the pill. That is the instruction, okay? One instruction. Then the other one would be, okay, if you feel pain in your head for so much time, you have to come back it means that it's not working, the medication I gave you, okay? It's another instruction. The recommendations would be try to eat better, take a lot of water, not drink coffee, and those kind of stuff, right? Okay, so choose another disease and tell me. Oh, for example, maybe you have a patient with a broke leg.
Broccoli.
What would be the instructions? So, yes, your patient is on pain, on really pain. So you will tell him, okay, I will put your dress, your pants, so I can see it, the break or your leg, so I can examine your leg. And you will feel this and this, okay? That are instructions. Maybe, can you move your finger toes, please? And the patient will move it. Okay, you have reflexes. You don't have a compromise on the tendon, for example, or something like that. Okay, those are instructions. So continue. Oh, we don't have enough time, Andres. You save yourself this time, okay? For
Yeah.
the next practical class, I will ask you about instructions. So think a lot about that, okay?
Yes, teacher. I think a lot.
Okay. Okay. Hi, Weimar. Don't go, Andres. Hi, Weimar. Just to let you know, to you both, next week I have some trouble with my schedule. So I will ask you, all of your classmates, and you, of course, that please we can have the same schedules as last few weeks. I don't know which was, but the first weeks, to in order to have the theoretical classes on Monday and Wednesday as always, but the practical classes would be for the first one divided on two. After the theoretical class would be one group. After the theoretical class on Wednesday would be the second group, okay? And for the second practical class would be on Saturday, as last a few weeks, right?
Yes.
Okay. But I will write down on the group so you can understand better, okay? And
Yes.
so you can choose your schedule. Thank you
Yes.
so much, Andres. See you on Monday.
Thank you, teacher. Goodbye.
Take care. Bye-bye. Hi, Weimar. How are you? Can you listen to me? Weimar, you're muted. You don't have the audio on. Okay, now I can listen to you. Can you listen to me?
Yes, teacher.
Okay, I'm with my camera off because of my connection. It has some trouble, okay?
Okay, teacher.
Okay, but Weimar, I want you please to pick up or to choose 3 conditions and imagine that your patients are going to your consultations and they are telling you, I feel this, I feel that, I don't feel well. Maybe you can describe in these 3 conditions how the patient would tell you how they feel.
Okay, teacher. Puede ser abdominal pain, diabetes, and migraine.
Yeah.
Migraine. Start with the clinical history. I start asking for personal data.
Details
Teacher,
or personal details?
datos personales.
Dates. Oh, data. Data. Okay,
Data.
I understand.
The
Data. Yes. Yes.
Um,
Continue, please.
how old are you? It is important because the older it is, the more risk. Where are you from?
Risk?
Risk.
Okay.
Riesgo, teacher.
Okay. Risk.
Where are you from? It is important because in Cochabamba there is a higher risk of type 2 diabetes owing of obesity.
Visiting. Okay.
What do you for a living? Do you have a partner? After current illness. For example, abdominal pain, where does it hurt? From 1 to then how much does it hurt? The pain squeezes you, stings you. Is the pain intermittent or continuous? Where does the pain radiate?
Okay.
Does the pain disappear or decrease in any position? Position.
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 Okay.
If he in pathology pathological in non pathological antecedents ask what disease do you have? Do you have basic services? If he has a disease, I ask him what medication he takes. Are you taking any medication at the moment? For example, in diabetes or migraine, do you use any other counter remedies or herbal or homeopathic medicines?
Okay.
Which tablets do you take? How many times a days? Uh, do you
Okay.
um,
Reymar.
teacher?
Reymar. Okay. I understand what you're saying. You are describing the whole medical history, right? And that's good. But my question or my instruction was to choose 3 conditions. Maybe you can choose one now. Okay, and imagine that your patient is going to your consultation. So how will the patient act, or what would the patient will tell you in this condition? Maybe if he has a stomach ache, he will tell you, I don't feel well, I feel sick, I feel nauseous, I have a pain in my stomach or a stomach ache. And you will ask, after all, some questions. But first of all, your patient will go with this condition. Maybe you can tell me, well, yes, he was with fever, he had an infection, but it's important that you tell me how the patient went to your consultation. What did they tell you? Okay?
Okay, teacher.
Okay. Once again, with any disease you want.
Okay, okay, teacher. Abdominal pain, dolor abdominal. Um, mm, in after current illness, where does it hurt? Um, from 1 to 10, how much does it hurt? Uh, o formulando la pregunta sería from 1 to 10, how much does it hurt? Del 1 al 10, ¿cuánto te duele? Is the pain intermittent?
Yeah, I know. Okay. You don't need to translate. I understand. You just tell me. Okay, that's good. One last thing. Can you give your patient instructions? Maybe you have to make an examination and you can give him instructions.
Madam, teacher sería señora, madam.
Ma'am, yeah, ma'am.
Madam, can you please get on the structure?
Yes, stretcher.
I will examine your abdomen.
Okay.
This this might feel a little bit of discomfort. I will be quick. Tell me if it hurts. Does it hurt here? We need to perform labs in abdominal ultrasound. It is to rule out other pathology.
Okay. Okay, Weimar, that was good. That was good. You understand the last part and you save yourself this time. Okay, it's going better. You're improving. Okay, can you see my questionnaire?
Yes, teacher.
Can you fill it for me, please? And since I give you the instructions for next week, I will tell you better on the group, okay? So you can understand.
Okay, teacher.
Okay. But it was good. You're improving your pronunciation. I already told you. But the only thing I don't like so much is that you're reading most of the time. I want you to know, I want you to tell me your opinion about some stuff, okay?
Ok, teacher, solo algunas partes que no entiendo, pero sí estoy ya.
Do you understand
Yeah.
better than before?
Yes, teacher.
Yeah?
Yes.
Yes, do you understand better than before?
No lo escucho muy bien, teacher.
Do you understand better than before?
Yes, teacher, me entiendes mejor. Yes, yes. Do you understand?
Sí, te dije, si entiendes mejor que
Sí.
antes.
Sí. Yes.
¿Y en las clases también?
Mucho mejor, teacher, porque ya.
Ya estás
Igual
practicando más.
estoy practicando, estoy viendo los videos, las pronunciaciones, entonces, y ya lo entiendo, como al inicio estaba sufriendo, pero ya es
Ya has mejorado.
mucho más entendible ya.
Ah, perfecto. Sí, he notado, noto. Y está muy bien, está muy bien. Entonces, me alegra mucho, Weimar. Seguí así ya, mejorando, practica un poquito, sácate la mostaza, porque solo nos queda una semana y luego es el examen final. ¿Ok?
Ok, teacher.
Okay. Thank you so much and see you on Monday.
Ok, teacher. Thank you. Goodbye.
Goodbye. Hi, Jocelyn. Good evening. Hi, Jocelyn. Can you listen to me?
Hi, teacher.
Okay. Jocelyn, I'm so sorry. I cannot listen very well. That's why I will keep my camera off, okay?
Okay, teacher.
Okay. Okay, Jocelyn, can you please choose one condition and make a note of how patients would describe the pain or how they feel?
Mm, voy a describir, teacher, ¿cómo?
Yes. Imagine you have a patient on your consultation. What did they tell you? Why they are going to you?
Ah, okay, teacher. Um, um, I asked the personal data. Um, um, for example, what is your name? What is your last name? Where are you from? What do you what do you for a living?
Mhm.
Um, mm, um, later, current illness. Um, mm,
But
for
Jocelyn, I want you to choose one condition. What illness or disease? Which
I
condition would you choose?
teacher.
Which condition would you choose?
Uh,
I
I
want you to choose one
headache,
condition.
headache,
Headache.
headache.
Okay. Imagine your patient is coming with a headache.
Uh,
Okay.
okay,
What did
teacher.
they tell you?
Teacher.
What did they tell you?
Mm, yeah. Um, um, the first the first they ask the patient uh, where does it hurt?
Where does it what?
Where does it hurt?
Where does it hurt?
Yes.
Okay.
Is the pain unilateral? Unilateral?
Unilateral, okay.
Um, you have ringing in the ear.
Earring,
Ear. Um,
but you have earrings?
ringing.
Ah, okay. Okay.
Ringing in the ear. No, teacher? Ear.
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 Yeah, ear.
Um, the light bothers you.
Okay.
Um, um, is, since
since, ¿cómo se dice? ¿Qué sería, teacher?
When have you been, yes, when have you been feeling bad? You can ask. Or since when have you been feeling like this? ¿Desde cuándo has estado sintiéndote así?
Sí, ¿desde cuándo?
Ajá. Since when have you been feeling like this?
¿Le digo, teacher?
Yes, you can repeat.
Yeah. Since when?
Since when have you been feeling like this?
Since been feeling.
Since.
Since?
Since.
Since. Yeah.
Since when have you been feeling like this?
Have been feeling like this.
Have you been feeling like this?
Have you feeling that?
Jocelyn. Ese es el problema que vamos a tener, corazón, con esto del inglés básico. Cuando uno sabe el inglés básico de manera correcta, o por lo menos lo básico, puede hacer este tipo de oraciones, porque después te vas a para después hacer lo que es el inglés médico, ¿no? Pero esto es básico. Necesito que practiques los tiempos verbales, por favor, hasta para preguntar, porque es como si le preguntaras, ¿dónde dolor? No, no tiene mucho sentido. ¿Dónde dolor? Duele, duele, duele. O sea, no te va a entender el paciente, es como muy brusco, ¿no? En cambio, tú tienes que decirle dónde le está doliendo, desde cuándo, hace cuánto tiempo se siente así, o sea, frases más completas, ¿ya? Y yo te digo, yo que te diga ahorita, vas a ir repitiendo como lorito, pero no vas a tener la capacidad de formular tus propias oraciones y eso no está bien, no es correcto, que no vas a aprender nada, o sea, no vas a poder aprender nada, ¿ya? Practica tus tiempos verbales, por favor, para que puedas formular oraciones. Desde el verbo to be, dale una repasadita y ahí vas a entender, te vas a acordar y luego vas a estar haciendo oraciones más concretas con lo que has aprendido también en clase, porque has aprendido, no es que no, pero no estás pudiendo o se te oculta porque justamente no estás pudiendo hacer oraciones con los pasados, presentes y futuros, ¿ya?
Ok, teacher.
Ok.
Sí, teacher, incluso ya me inscribí a un curso básico de inglés.
Está muy bien. Es lo mejor que puedes hacer. ¿Ya? ¿Ves mi cuestionario?
Sí, teacher.
¿Puedes llenarlo, por favor? Ese curso, ¿de dónde o sea, cuál te inscribiste? Inglés básico.
Sí, teacher. Me inscribí a uno del speaking.
Ya. Está
Del
muy bien.
speaking. Teacher, ¿cuál curso me recomienda así bien? Porque le cuento, teacher, que estoy llevando desde el año pasado es el speaking, pero, o sea,
¿Estás mejorando mucho?
no, me gané ese curso así con una beca. Entonces, porque quería yo aprender inglés así, ¿no? Y Entonces nos cambian de docente, hay una docente buena, hay otra docente mala y no pues, tengo más intriga, digamos, de aprender más el inglés, ¿no? Por eso también me he metido ahí de el inglés especializado en medicina, pensando que tal vez yo me imaginaba que íbamos a aprender de básicas y de cabezas y algo, ¿no? Pero no había sido así, pero y me doy cuenta que hay muy capas ahí.
Y es que es para un B1, ¿no? Es para un nivel un poco más avanzado. Tienes que estar con el inglés casi perfeccionado y luego ya es inglés médico técnico, ¿no? Técnico médico. Entonces, ahí se nos dificulta. Yo te recomiendo que el curso que tomes, que sea de inglés básico, pero no de speaking solamente, sino que gramática, ¿no? Que te puedan enseñar a formular oraciones, porque una cosa es que estemos hablando, ¿no ve? Tú y yo como loritos hace rato, pero no me entiendes lo que te
Le,
quiero decir.
le entiendo, teacher, pero le entiendo así. Hay algunas palabras que no logro comprender, pero algunas cosas sí he aprendido bastante porque hay muchas cosas que no sabía. O sea, le entiendo, pero hay algunas partes que no lo entiendo.
Este es el problema. Tú me entiendes, pero no me puedes responder. Y
Ajá,
eso es porque, ajá,
ajá,
eso es porque no estás, o sea, no tienes la base de inglés. Por eso te digo, tiene que ser desde el principio, desde lo que es el verbo to be, ¿ya? Ese verbo de ser o estar, ¿no? Yo, él, ella, ellos, y vas a ir viendo en presente. Estamos, somos, ¿no? Ya en futuro,
sí.
van a ser, van a estar en pasado, estuvieron o han estado, ¿no? Y ya tú te vas a dar cuenta cómo se maneja.
Ujú.
Eso es lo básico para formar oraciones. ¿Ya, Jocelyn? Yo te
Gracias,
recomiendo,
teacher.
yo te recomiendo que cursos en inglés gratuitos deben haber en YouTube. Son buenos, no son malos tampoco, ¿no? Por lo menos para que te vayas dando cuenta de qué es lo que te hace falta. Inglés, curso básico de inglés. Entonces tú entras y escoges, ves uno, entiendes todo, ves otro para reforzar, si te gusta o no te gusta, eso vas a hacer y vas practicando al mismo tiempo. Es que lo lamentable es que, como te he dicho, estamos contra
Ok.
el tiempo, así que vas a tener que
Ujú.
ponerle un poquito más de horas, ¿ya?
Ya, ok, teacher.
Muy bien, Joseph. Entonces nos vemos el lunes. Mañana les voy a pasar un mensaje sobre los horarios de la siguiente semana, ¿ok?
Ok, teacher.
Okay, see you. Take care. Bye bye.
Goodbye, teacher.
Vale, thank you so much. I'm so sorry.
No, it's okay, teacher. Don't worry. The point is that I don't have the camera for this class. I don't know if it's okay. I'm
No
really sorry.
worries. I have the problem with my camera too. Well, with my connection. Okay, and it's better if I stay without a camera
Yeah, I
on.
understand it's better. It's better. It's okay. But thank you.
Okay, no worries. Okay, let's start. Mm, can you choose three common conditions, and make note of how patients will describe the pain or how they feel?
Okay. Maybe we can start with pain, abdomen pain, like
Okay,
conditions. Like I don't understand.
abdominal pain.
Okay, abdominal pain. Well, I think it's important to describe or or ask to the patient, for example, how started the pain. If
Mhm.
it's like suddenly, suddenly,
Suddenly.
suddenly, sorry,
Mhm.
suddenly, or it had, or it progress of, or if the pain progress. Then where, in which part of the abdomen is the pain starts,
Mhm.
Uh, then the intensity of the pain, if the pain's it's only in one place or maybe it goes to another. For example, in when you have appendicitis,
Appendicitis, exactly.
the when you have appendicitis, the pain start in the stomach, 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 and then goes to
Stomach.
the, okay, thank you, teacher, stomach. First start in the stomach, and then after maybe, I don't know, 10 hours, the pain goes to the down part of the right side, or the place where is the appendix. So it's important to know if the pain it's only in one place or it goes to another, or the pain it's in two places, like in the front and in the back. How is the characteristics of the pain, the duration of the pain, if the pain, I don't know, it's only for one day and then disappear, or the pain it's still,
Mhm.
then the the way, because it's there's a lot of ways of the pain. For example, like you can feel like something is with fire, or maybe something that is like, how do you say this word, punzante.
Okay.
I don't know how to say.
Okay, let me check. Continue, please.
Okay. So I think it's important those questions, because depending of the how the pain start, the type of the pain, maybe if the patient's put in a position, the pain is low, or if they move, the pain is more painful, you can say.
Okay, stinging. It would be the word we're looking for.
Punzante, exactly. It's stinging. So I think it's like nine types, or nine types of pain. So I think those are important, because in talking about abdomen pain, you can say that it's a world. It's
Okay.
one symptom, but it can be, I don't know, 10 diagnoses or 12 or maybe more. So I think it's really important to take care and try to, you can say, understand well the pain, like how it start, when it start, the type, the duration, if it's with movements, the pain it's more or less.
Okay.
Mm,
Okay. That's good. I understand everything. So now, can you make a? Can you listen to me?
yeah, yeah.
Okay. Can you make a social history of a patient you already know? And maybe
Mm,
you would ask some questions to obtain the information.
okay, like if maybe like a patient that come to emergency. Yeah.
Yes, yes, it
Okay.
can be.
Well, I think it's important first starting um, to asking like personal details, like name, date of birth, how many years, um, then if it's married or single, uh, maybe where he lives, and if the patient have like all the commodities like light, water, and those stuffs. And then I think it's important to ask the habits of the patient, like if he smoke or drink alcohol. If the answer is yes, you maybe ask the frequently the of the person.
Frequency.
Okay, the frequency. Thank you,
Mhm.
teacher. The frequency of the patient of drinking. Then, if he use any drug, if he has uh, any illness like chronic illness,
Mhm.
and also if he or she had an surgery.
Okay. Okay, that's good. And
Like
the last, oh, sorry, continue.
uh, that's for a start, and then you have to ask why is he or she is coming, the cause of the person is going to the hospital, and then
Mhm.
try to ask to tell that the person tells you the history of how the uh, illness start, and if the person do something or drink something or take a pill, so you can understand the history, and then you go to make the examination, and then you can give a diagnosis and a treatment.
Okay. Okay, Vale, thank you so much. And the last question, maybe you can give some instructions to your patient during examination. You choose what kind of examination you will do.
I think it's important, no matter where is the pain, like the basic things is to see the eyes, to see if they are white or maybe yellow, see the tongue, so you will see the if the person is irritated or not. Then you have to take vital signs. I think
Yes.
is really important, no matter what happened with the person. It's important, and then depend depend of where is the pain or where is the problem. You are okay, you can do like a general examination, but for example, if you have abdominal pain, okay, I will hear your lungs and your heart, but like so quickly. But I will take more time examining your um, abdomen, because the pain is there.
Mhm.
So I think for to examine the heart, you don't have to say anything. Only the person of the patient has to be in the coach. And for the lungs, I think it's important because you have. It's better when the patient start breathing like if he or she is tired, so you can listen the sounds of the lungs better. So you have to say, please, can you breathe like if you are tired? And also you can do the way so the person will understand better.
Okay. Okay, that's a good thing. It was just I was looking for. Okay, Vale, thank you so much.
No,
You
thank you to you. Thank you to
will
you.
well prepared. Um, I just will take a picture here or two maybe. And I will put an announcement tomorrow about the schedules for next week, okay?
Okay. Teacher, I have a question.
Yes.
The, I don't know if I understand well, but yesterday you said that the last week it will be the last, yes? Or
Yes.
this was the last?
No, next week will be the last. And
Okay.
then on
You
next
will have
Monday, after that, we will have the final.
Okay, thank you, teacher. I understand. Okay, I understand good.
Okay, thank you so much. And tomorrow I will tell you the rest, okay?
Okay, teacher, don't worry. It's okay. Thank you. See you
Thank you so
Monday,
much.
and hope you have a great weekend and a good holiday. Yeah,
Okay, you too, right.
today
You too,
is
Vale.
6
Take care.
exactly. So
Bye bye.